This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond. We have a very important subject for our viewers today, and we have a champion here to talk about that subject, the subject of adoption. Debbie Johnston, thank you so much for being on This Week in Richmond. And you are an adoption champion, so named by the governor. But prior to that, you were already an adoption champion because of your own personal experience. So it might be helpful to our viewers to kind of help them focus in some on adoption by telling them some about your own personal journey, your own experience.
Well, David, I got really lucky. I'm one of the lucky ones, and that's why I feel like I will end up being a very good voice for the children that need to be adopted. I'm adopted. I'm adopted myself, and I am the oldest of 6 kids. I got very lucky. Not only did I get great parents, I got 5 siblings that I've gone through life with. And my parents didn't have a lot. My mom is a secretary, and my dad was an electrician. And they really worked hard to have enough money to feed us. You see, it doesn't take a lot of money to love a child. And
Yes.
that's what I got. I got love from parents, and that's what these 820 plus kids in Virginia that need a mom and dad need. They need parents that love them.
So you speak of 5 siblings. Were they also adopted?
No. Mine was actually an interfamily adoption, and my 2 sisters, my 2 mothers were sisters. So my adopted mother and my biological mother are actually sisters. And as I'm learning about my position, this is the thing the state wants the most, is they want to find a family member to take a child that's been put in foster care. It makes the most sense.
And you mentioned a number that more than 800 right now?
More than 800 right now.
And we're going to put up on the screen right away, and we'll have it up several times during the show, the 1-800-DO-ADOPT.
Yes.
That's the adoption hotline where someone can call, get information about what they would need to do, I guess, as a potential adopting parent.
Yes. You know, one of my goals in this role is to really have awareness. We do a great job, don't we, of saying when someone needs a dog or a cat, when they need a home. And rarely do we talk about our children. And I'd love to see it change, that we talk about what children need homes as much as we do pets. And you just don't hear a whole lot about it. But they're out there and they need parents.
You know, over the years, there have been private and state facilities that were children's homes where they'd be
Yes.
since raised all together. But you're talking about adoption.
Yes. And that, I think, is one of Governor McAuliffe's goals, as is mine. We would like to have 100% of Virginia children adopted into loving homes, permanent homes, homes where they're not moved from foster home to foster home, but one set of loving parents.
So some of these 800 or more youngsters are in foster homes now, but not permanent homes.
Right. And they know it. They know it's
Yeah.
not permanent. They know they might be moved. And there's so much stigma that goes with not only being a foster child, even when you're adopted, and I can speak from this. When you're an adopted child, I know with me, kids would say, you're different. You're not the same. You don't really belong in that family. And it was very hurtful. In fact, I think that it's one of the things that made me become an overachiever. I thought, well, I will be as good as the other kids. So my work history speaks for itself. I've been wildly successful in my business, Care Advantage. And I think it came from hearing those things as a child. And it's another thing we have to work on, that these children are chosen, not that they're different, and get rid of that stigma that goes with being adopted.
So the governor has asked you to serve in this capacity. You're a volunteer
I'm a volunteer.
and working within the Department of Social Services.
Yes.
So I think that's where that 800 number goes.
Yes. I also work closely with a program called Great Expectations, which is a program to help kids after they're 18 get through the college system, because many times when a child turns 18, they're out of the foster program and they don't have anyone to really mentor them, and they flounder. And Ann Holton did a good job of starting that, and it gives them mentorship through their college experience so that they can keep going even after they turn 18. It's a wonderful program in every single junior college.
So and that's I guess a statewide program?
Yes.
Well, when you mentioned the name, I was trying to connect someone with it, and it was Ann Holton.
Yes, she's
who really,
lovely. I believe she started it, and she's very passionate about it. And I've actually done some speaking with some of the colleges about the program.
So the goal is to, instead of just having that child all of a sudden, now officially an adult by age, just completely on their own, but to keep them connected, to try to help them get to college. Tell our viewers a little bit what about this program. Yeah, what does
What do they do?
Yeah, what does it do?
They're actually assigned a mentor who helps them to, when they're feeling like they can't make it, keep going.
Mm-hmm.
When I was in nursing school, I had comrades that would say, oh, okay, you can make it, stay up till 3 o'clock in the morning and study. And the mentors do that for the kids because they don't have anyone. They turn 18, they foster out, and we stop at 18 for most of our kids. And then they're off to college. And college can be a bewildering experience for everybody. And so if you don't have somebody saying you can do it, you can get lost in that process. So that's what they do.
So does that program also need volunteers in? I suppose it uses.
Yes. And they do fundraisers. I did a talk at John Tyler recently, and there had been a fundraiser. And they gave all the kids book bags, pens, school supplies, and their faces and how excited they were. It was just so awe-inspiring.
Well, that is exciting. So the goal now, going back to the adoption champion, is to find people throughout the Commonwealth who will call the 800 number,
Yes.
get some information, and then get started in the process.
Yes.
Yeah.
Become a parent. I think if you've watched The Blind Side and Luann Tooley and her story about Michael Orr, God, I watched that movie a lot because I'm trying to embrace what it was in her that got her to adopt Michael Orr. We need over 800 Luann Tooleys.
Mm-hmm.
Have you seen the movie?
Yes. Oh, it's powerful.
It's very powerful. And I watched to see what it was in her, you know, and it really boils down to opening your heart, because that's what it is. Open your heart, take in a child, love a child, mentor a child, help a child become somebody, and you never know who they're going to be. They could be another Michael Orr.
And you said from your own experience and also one of the goals that some of the ones doing the adopting may be a part of a family, be a relative.
Yes. That happens as much as we can get it to happen in our state, because that usually produces the best outcome.
So the people who are watching the show who are not family members but who would like to help, I suppose they might be young with children or without children, or they could be grandparents' ages, right?
Yes, they can. My grandmother raised children till she was well into her 80s. And it kept her young. It kept her evolving. And in her 80s, she was taking care of 2 twins. And she loved children. She got a lot back from that.
So if people need to get a champion out to speak around the state, or if they call that 800 number, if they want information, they can get you or get someone to come and
Yes.
talk.
Yes, I would love to come and talk to people about it, because adoption made a difference in my life. I don't really know how it would have turned out had I not been adopted. I'm one of the lucky ones. I had a full family. It was great. I feel so lucky. And I want to be the voice for the children of the Commonwealth and help them get what I got. Loving parents, siblings, just a full life.
Well, Debbie Johnston, we thank you for being a champion, for using your own life experiences and being willing to serve as a volunteer and being a champion for adoption. And we encourage our viewers, look at that number, 1-800-DO-ADOPT, and call. And let's find homes for these 800 children.
Thank you, David.
So that they can be in a, as you said, in a loving home.
Thank you, David.
Thank you very much for being on This Week in Richmond.
Thank you.
With all the tension that's taken place both in the nation and the world on healthcare, we're delighted to have Dr. Marissa Levina here, Commissioner of Health in Virginia, to talk with our viewers some about healthcare issues here in Virginia. I know you were here before the General Assembly very recently to speak, and let's start, if you would, by telling our viewers what you would want them to know about the so-called scare that we have in this country and around the world.
Thank you, David. It's a pleasure to be here, and it is a scary time for a lot of people because we have a new disease that came to the United States that they don't understand, and they're certainly worried about. So I think it's a really important time for people to take a deep breath and make sure that they have the information they need to make good decisions. And that's a role that is very important, both for me as the State Health Commissioner and for the Public Health Department here in Virginia, to make sure that people have access to information that's reliable and timely and actionable so they can make the decisions they need to. It's a time certainly of caution and concern, but at times of caution and concern, it's really important that people pull together and have good information to do so.
You know, with the concerns that people have about the hospital in Texas, probably be helpful for them to know that there are, I believe, 6 hospitals I've heard in Virginia. I mean, that ones regionally ones that have been not just geared up now, but have been at other times for crisis.
That's very true. In fact, there's been an effort for well over 12 years now to build a hospital and healthcare and public health system that can deal with crises and emergencies regardless of what type or what the issue is. And the good news is we have put together 6 regions in the state where each region is well coordinated among the hospitals. And so if there's a major issue, they've got a capability to stand up a coordinating center, make sure that they can communicate appropriately, that patients can get to the right facility when they're needed, and that the facilities can be ready, both with the equipment and the training. I think the interesting issue with Ebola is making sure that that training and that readiness translates into what we know we need for Ebola. And that's been the issue, I think, in Texas, which we do not want to replicate here in Virginia. And I think I can say very comfortably that all of the facilities have geared up in their training and their education and looking at the resources that they need, and they're doing that in a very collaborative manner.
You know, very recently here in the capital city, there was a concern, probably for some a scare, but it seemed to have been handled in a very highly professional and good medical way, and everything seems to be okay from that.
I think that's a good observation. It really went as well as you can expect, despite the craziness of the times and the concerns that arise. And I think that's to a large degree because the different parts of the healthcare system, I look at it as the big public health system over and above governmental public health, hospitals, healthcare providers in the outpatient arena, the EMS workers in ambulance and other vehicles, and public health have actually all been drilling, practicing, talking, and building up a communication capability. So as state commissioner, I've put out information to all providers so they'd have some background information about what they need to do both to prepare and then what would happen if they had a suspected case, to make sure that they responded appropriately and communicated to whom they needed to. And I think what we saw here in other parts of Virginia was that people are doing that. They're talking to each other, they're assuring that the connections are made, and they're really testing systems that we already have in place, and those systems are working.
So apart from this, which has certainly been high focus and occupying a significant amount of time and attention, what else is the Commissioner of Health doing? I mean, tell our viewers about some other matters that you're working on.
I think the Commissioner of Health is involved in many things, from the regulatory activities relating to making sure hospitals and healthcare facilities meet the standards that people expect, to that on-the-ground, day-to-day public health activity that could include what we were talking about with Ebola concerns, which is surveillance of diseases and investigating issues to make sure that control measures are put in place. And that runs the whole gamut of both diseases and environmental health issues. We also regulate drinking water systems in the state, so all the municipal water systems, and private wells.
Yeah, so that falls under your...
That falls under our purview too. Private wells are permitted by our local health departments, for example. And then we actually provide service in our health departments too, which includes a federal program, the Women's Infant Children Program, which is really important to make sure young mothers and their family have not only the foods that they need, but the education to make wise choices. And that's been a very important part of the program. In addition, everything we do is about prevention. So immunizations are a very big part of what we do and what we promote. And I'd have to make the point now for people to take flu seriously, because the flu season is starting. This is a great time to take inventory about what you personally need to do, what you need to do with your family, and also if you haven't taken advantage of flu vaccination. I think that's particularly important this year, not because I can predict what the flu season will be like, but because with the concern about Ebola and the fact that Ebola symptoms are nondescript, they could be like flu symptoms, we just want to minimize any confusion. Great time to take inventory of that. So that's a small example of what I'm involved in, and there's much, much more on a day-to-day basis.
Well, while Ebola certainly can be very scary for any of us and all of us, and while I certainly don't minimize, nor would you, the tragedies in Africa, I think I've heard it correctly that more people die from flu, result of that, than from a very serious illness that comes from Ebola. And so when we can get vaccinations that help protect a significant part of that, it looks like all of us would.
Well, what I would say, David, is that first of all, my hearts go out to everybody who's been affected by Ebola, both abroad and here. It's a horrible disease, and it's unprecedented in terms of the outbreak in Africa, and really heartbreaking. And I'm glad to see the world is working to try to contain that because it's to everybody's benefit. As you say, though, there are many diseases that we have to pay attention to, and quite frankly, I would bring attention to another arena that we work in is to prevent chronic disease, because more people die in Virginia from cancer and heart disease and stroke and many others than die from infectious diseases. And I don't want to minimize any of them. They're all important. But to put it into context, some of the choices we make every day make an even bigger impact on our lives. Flu vaccination is an important choice. What we eat, staying physically active, stopping smoking if we smoke, those are all critical decisions that individuals have to make, and the public health system works to make those decisions easier for people in Virginia.
You know, you came into this position this past March at a time where there certainly were some tensions, I'll put it that way, with regards to some of the women's health issues in some of the clinics. Any update that you would have on that? What's the status of the healthcare clinics for women, some of them that were closed?
So you may recall that the governor directed the health department and the Board of Health to reevaluate the regulations that exist for abortion facilities. So that is underway. That will be a many-month process, and it gives us an opportunity to step back and make sure that the regulations that are in effect are most appropriate to do what they are intended to do, which is to protect patient safety and health. At the end of the day, that's what really matters, I think, to Virginians. That's what matters to me, and I'll carry that out to the best of my ability. I think the other thing I would say is it's really an important time, particularly when the country is politically polarized, for us to also take a step back and come together on many issues. I think the issue with Ebola, for example, is a great opportunity for people to come together and make sure that we're working hard. I was very pleased this morning that all of the state agencies have come together on what we call a unified command approach, to be organized to assist each other and to make sure we all know what some of the issues are, and that we use all of the state's resources appropriately to help people and prevent them from having to deal with an issue like Ebola. I've seen, having been involved with many emergencies and urgent situations in Virginia, that Virginians come together at times of crises. And I would love for us to continue to push in that vein, and I'll do everything in my power as a state health commissioner to get people working together on the issues from a perspective that really focuses on our well-being. And I've told my staff that I have a very humble goal for us, and that's for Virginia to be the healthiest state in the nation. And I don't just say that and dismiss it offhand, but having traveled around the state, I see so much great opportunity for us to do that.
Our time has run out, but let's hope that's the case.
Well,
thank you for your service.
You're welcome.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.